Hello and thank you for joining me today for another Leadership Rounds discussion. I'm Rod Hochman, the President and CEO of Providence and the Board Chair of the American Hospital Association. This month, we'll focus our discussion on how we can improve health for mothers and babies by addressing longstanding inequities in maternal care. Today, a Black child is more than twice as likely to die during infancy as a white infant. A Black woman with a college degree is 5 times more likely to die from pregnancy-related complications than a white woman. And alarmingly, the national rate at which Black women are disproportionately affected has not changed since the 1940s. Other groups of moms with high mortality rates include Native American, Alaska Native, and Pacific Islanders. This is unacceptable for our communities and our nation. The data compels us to do better, and we can't wait any longer to change these inequities. That's why I am so pleased to have with me today Stacey Stewart, President and CEO of the March of Dimes. Stacey has led the March of Dimes since 2017. Prior to her role at the March of Dimes, she served as the U.S. President of the United Way, and she drove the national efforts in education, financial stability, and health, and was instrumental in transforming the United Way into a leading organization for local community impact. Stacey also served as the Chief Diversity Officer and Senior Vice President for the Office of Community and Charitable Giving at Fannie Mae. The March of Dimes is a national leader in maternal and infant health and has for so many years pioneered advances in improving outcomes for mothers and babies for now 8 decades. The AHA was pleased to be partnering with the March of Dimes in 2019 to further advance the work of healthcare providers in recognizing and addressing inequity in maternal care. In recognition of this organization's leadership, the AHA voted in 2020 to present the March of Dimes with the association's Award of Honor. Presentation of the award has been delayed because of the pandemic, but I'm delighted to give it to Stacey today. Let me read briefly from the award citation. For 80 years, through its legacy of leveling the playing field for moms and babies, no matter their age, socioeconomic background, or demographics, its advocacies for policies that prioritize the health of mothers and its pioneering research to find solutions to the biggest health threats to moms and babies. March of Dimes has helped millions of babies survive and thrive. That legacy lives on today as the March of Dimes leads efforts to address maternal and infant mortality and morbidity, health equity, and often partnering with others to deploy implicit and unconscious bias training, raise awareness of neonatal abstinence syndrome, and address the opioid epidemic in expectant mothers. Quite a challenge in all of those. In recognition of this exemplary contributions to the health and well-being of mothers and babies, the American Hospital Association is pleased to present its Award of Honor to the March of Dimes. Stacey, congratulations. This is a well-deserved honor, and let's jump into our discussion, and it's great to have you with us, and we're so pleased that we can honor the incredible work your institution has done.
Oh, well, thank you so much, Rod, and it is such an honor, and coming from AHA, it's really makes it even more special, and so I'm really honored to accept the award on behalf of the March of Dimes, and really appreciate receiving it on behalf of the organization, because we do feel like we're doing some really important work, and we know we can't do it alone. We've got great partners like AHA and so many others, but it's great to be recognized in this way. So thank you so much.
Thank you. So I'd say first and foremost, it'd be great for you to share with us the March of Dimes top priorities for improving mothers and babies. So I'd love to hear that from you.
Sure. Yeah. It's, as you mentioned, I started an organization in 2017. We were already doing such tremendous work in especially in the area of premature birth. And we continue to do that work. We have 6 prematurity research centers around the country, and then one in the UK. And we have, really pursued a very ambitious agenda around research, medical research, especially as it relates to premature birth. We have invested in other science in the areas of maternal health. And that's always been a very important part of the March of Dimes. A lot of people don't know that we actually do a lot more, even more, around maternal and infant health beyond just academic research. You mentioned one particular area around education and training. We actually provide millions of women with consumer education and the kinds of things they need in order to have healthier pregnancies. We invest a lot of our resources into training healthcare professionals, like our implicit bias training, because we think it's really important that we continue to invest in our healthcare professionals to train them and to partner with hospitals to make sure they have the best tools available to improve maternal and infant health care to the extent that we can support that. We have a very ambitious agenda around advocacy. In fact, even today as we speak, there's a markup on the Hill around extending Medicaid postpartum for 12 months, which has been a huge area of focus for us. So very exciting day to day. And then we obviously engage the public in building awareness around what we have had even before this pandemic, which is a significant maternal infant health crisis. And now with the pandemic, it's only been made worse. So we've got a pretty big agenda, the March of Dimes, and we feel like, we're really focused on 3 big areas. One is around continuing to focus on reducing, eliminating preventable premature birth, especially since we know premature birth is a leading cause of infant death. We know that about 2/3 of infant deaths have actually occurred in cases where the babies were born prematurely. The second area is around maternal health. And I think this is one of the areas where a lot of people are now getting used to hearing us talk much more around not just healthy babies, but healthy moms too. Because one of the things that I really saw very clearly when I came to the organization was that it was going to be very difficult to ensure that babies are healthier if we still have too many moms, too many women, even before they become pregnant, with chronic health conditions and a lot of things that really affect the health of the baby, having a healthy pregnancy. So we really tried to move much more upstream to focusing on healthy women, healthy moms, healthy pregnant women, healthy moms to ensure healthy babies. And then, of course, the last area is around our equity gap, our health equity gap that exists. And so it's those 3 areas that we've been very focused on and continue to sort of form the strategic framework for all of our work at the March Times.
That's a fantastic framework. And, we talk so much about the social determinants of health, and nowhere are they more relevant in the health of moms and babies. And I think you guys are the advocates of that. And then I think, as we've seen with COVID pandemic, it oftentimes gets forgotten about what's happening to moms and babies during this pandemic.
Yes.
I can relate personally. I had my first grandson born in the middle of this pandemic. And in a lot of ways, you kind of look to the March of Dimes because who speaks for the moms and babies? Because, everyone was worrying about a lot of other things. And, what are we, how are we worrying about these moms? And, we've seen some statistics, in postpartum moms as it relates to COVID-19 and their susceptibility. What about vaccination? All of that. And that's where I think people look to you and the March of Dimes to say, can you get in there and advocate for that group?
Yeah, absolutely. Last year, around this time last year, we were all beginning to wake up to what this pandemic potentially could mean for all of us. And what we began to recognize very early in the year last year and in the early stages of the pandemic is that, people were starting to put a lot of things on pause or to shift and go virtual on a lot of things or to cancel a lot of things. We had March for Babies events that were going virtual, and other organizations were canceling their in-person events, or schools were going virtual. Kids were still at some level able to go to school, but you did it at home. But the one thing you can't put on pause and you can't make it virtual is pregnancy.
Right.
If a woman is pregnant or became pregnant or was already pregnant when the pandemic started, she, was, probably intending to continue that pregnancy and have that baby.
Right.
And in the midst of, something that a lot of us can imagine, like bringing a child into a pandemic with the risk of the mom catching COVID-19 herself, the questions of whether or not, it could be passed to her baby, what impact it would have on her, would it affect her health or the health outcomes of the baby? I mean, these were very, very stressful things and still continue to be very stressful. The idea of going into the hospital and not being able to have your partner with you. We had women that had to deal with that situation, and hospitals having to make, policies on a case-by-case basis on what was in the best interest of hospital, personnel, as well as the moms in delivering their babies. Just incredibly stressful times. And, we're not through it yet. And so, the March Times was kind of there to make sure as we were getting more information about what the pandemic meant for pregnancy, sharing that information. We began having weekly Facebook Live sessions to get information out to women because they were just, clamoring for information, clamoring for answers on what to do. We started a COVID-19 fund so that we could begin to really push hard to make sure that if a vaccine were to be developed at that time in 2020, that it would be safe for pregnant women. Here we are today with a vaccine, thank goodness, that is available, and we're encouraging pregnant women to get it, but we don't have that gold standard of proof because pregnant women were not in the clinical trial, so we're still pushing on that front. So there's a lot that is really important. And of course, when you talk about the impact on communities of color and what this pandemic has meant for communities of color in general, what it's meant for pregnant women, and still dealing with maternal health outcomes, as you mentioned at the beginning, Rod, that have been far more detrimental to women, moms of color, pregnant women of color, and we're still dealing with the layers of that additional stress through the pandemic. It's just meant that, for the March Times, it's been more important than ever for us to be that voice for moms, for babies, and to try to be the loudest voice in the room as advocates for what they need to preserve their health.
And I know now at least we have a vice president that understands these issues. She, with our hospitals in California, she's always been a very, very strong advocate for a lot of these issues. So it's nice to have someone, close to the top there that
Absolutely.
feels passionate about these issues as we do in healthcare and March of Dimes. And, the other thing that the AHA has been in partnership with March of Dimes is about, which we've discussed a little bit, this implicit bias educational experience with providers who care for women before, during, and after pregnancy. Why don't you share a little bit why you took on this work, and then what's the potential for this education to improve outcomes? Because that's really what we want to look at. But I think that's an important area that you brought to us, and I think hopefully to the whole country.
Well, I think, if I could just say, I think part of, I think my understanding about implicit bias as it relates to physicians, to nurses in the healthcare system really got formed when I was young. My father was a physician and practiced medicine in Atlanta for 50 years. And most of his patients were Black, the vast majority, most of them Black women, most of them on Medicaid or Medicare. And I knew that they sought care from a doctor like my dad because they implicitly trusted or felt that they had a sense that what a Black doctor would tell them as a Black woman would probably be coming from a place of that there would be a reason to trust that advice or the support or the help that was the diagnoses that were being provided, and that kind of thing. And you have to wonder where did the distrust come from, right? And I think it doesn't take a history buff, although I love to study history, to really look at the roots of kind of where that distress comes from in this country, and where and why so many people of color in this country have a lot of good reason to not trust the healthcare system. And a lot of us are revisiting a lot of these issues now because of this pandemic. But when you look at this Tuskegee experiment and Henrietta Lacks and the stories that of how Black people have not been always dealt with in the most appropriate and most trusted way, by the healthcare industry, it's not hard to understand, why Black people may have these issues of mistrust. I think another thing about what has happened is that a lot of us actually do have our own implicit biases about a lot of things. I have them. We all have them. It is a human thing to have a bias against something, and you may not even recognize it. Added to the fact that sometimes in our medical school programs or our other training programs, we may have implicitly embedded things in those training programs that actually perpetuated some of those biases, right? So these things are things that have been going on for many, many years, that our implicit bias training was, all it attempts to do is not solve racism or completely cure people of implicit biases. It is intended to simply raise awareness around the fact that we may all hold that implicit bias around it. And to the extent that there's implicit bias that interferes with or affects the kind of high quality healthcare that we know everyone deserves, including people of color, then we should do our part to invest in healthcare providers and professionals going through a process where they uncover what those biases are, and then begin to understand how they can eliminate that bias from then interfering with their ability to be the best doctor, the best nurse, the best healthcare professional for any patient, irrespective of race, income, insurance coverage, that everyone deserves that level of high quality care. And that's really the intent and the purpose. And what we had seen with implicit bias, it was playing a huge role in the outcomes around moms and babies. And our specific objective is to ensure implicit bias can be checked at the door so that every Black mom and brown mom can receive high quality care as well for herself and for her baby.
Yeah, I think, there are two areas, and I think the awareness is exactly the way you say on implicit bias. But there's also a discovery too of what I would say is explicit bias. That you talked about. When I've gone back, I'm a history buff in healthcare, and we're so guilty of it. How many of our hospitals were segregated for such a long time? So even in the Northwest in Seattle, okay, you could practice here. But if you were of color or of a different faith, you only had one place you could go to. So it's not that long ago. And so I think there's an owning up to the fact that in healthcare, in where you and I live, there's been a lot of explicit bias in terms of just how things were. And now we're starting to discover, I think you said it beautifully about implicit bias and just being the first step is awareness. And I remember as we were doing this, we did this with our senior teams, and it really opens up the discussion. And just getting to that stage really helps us start to heal and understand what we need to do. But the other thing that's been really troublesome that I wanted to hear your thoughts, we've stared at racial inequities in healthcare for a long time. It reminds me of when we looked at safety in healthcare, and we stared at that, crossing the quality chasm, and it took like 20 years for someone to recognize that we were unsafe. We've been staring at this health inequity issue for a long time. So if you ask any of us, I've got a lot of data ready, whether it's in how moms are treated with breast cancer or maternal and fetal health. What do we do to improve it? Because I'm a big one in saying, let's stop talking about it. Let's do something about it. What would you say are the most important first steps we should take?
Yeah, absolutely. Well, couple quick things I just want to say about the explicit bias and racism that has existed. I was born in 1964 and in Atlanta. And my father, who I talked about, was led a group of doctors who, that was obviously the same year the Civil Rights Act was passed, and my dad and some of his friends led a group of doctors to continue to document the cases of segregation that existed after the Civil Rights Act was passed. Took that information to President Johnson and ensured that the federal government would then come and force the desegregation of hospitals in the South, including Grady Hospital, which is, I know I don't need to tell everybody what Grady is. I served on the board of Grady Hospital for 7 years. I wasn't on the medical side of things. I was the chair of the finance committee. How about that? But my dad was a key part of desegregating Grady Hospital. I ended up serving on the board of Grady Hospital, which was kind of a sweet bit of irony in our family. And so I feel like in my lifetime, I've lived to see this idea of moving from explicit, racism in healthcare industry. We still have some of that, and then we've got a lot of implicit bias. So there's a lot of work we have to do. But this is the important point about it, is that this is in our lifetime that we have still been struggling with these issues. Yeah. But here's the most important thing to recognize, and everyone's got to really understand this. We have never had a period of time in this country, ever, where the descendants of the formerly enslaved and other people of color have ever had the kinds of investment in our communities that would allow us to have equal access to high quality healthcare as compared to white people in this country. It has never happened. Yeah. We've had explicit policies that have kept Black and brown people from accessing high quality healthcare. We've had efforts, even by medical professionals, the American Medical Association, on more than one occasion, to actively lobby against universal healthcare. One of the reasons we don't have universal healthcare today. We had slavery, we had Reconstruction, we still had Black people with no access to high quality healthcare, all during slavery, during Reconstruction. Now we're in Jim Crow, through the end of Jim Crow, we're at 64, and here we are in 2021. So we have to be really clear about the fact that you're right, we probably have been staring at this issue for a long time, but we've been observing it as if it's not actually affecting people's lives. Yeah. And there has to be a point in time when we have to say, we're going to stop observing it as if this doesn't matter in our country, as if we're going to continue to accept that we are the wealthiest country in the world with the worst health outcomes as compared to other highly industrialized wealthy countries. How are we going to sit here in this country and accept that is okay for us to be that is going to position the United States of America to be the strongest, most competitive country in the world? How do we justify that? How do we reconcile that? We can't. Yeah. So I think at some point we got to recognize that as long as we continue to have policies in place that don't give people access to the right kinds of health coverage, and as long, and I'll finish with this, as we continue to understand that 80% of our healthcare is really not determined in hospitals and in the doctor's office. And it is wrong for us to put the care and the health outcomes of Americans, and solely at, the blame of it and solely in the lap of our hospitals and healthcare professionals. That we have to make sure that if we want people to be healthy, they have to live in healthy communities. They have to live in healthy, safe, decent, affordable housing, that they have to have good, safe, highly effective schools in which to send their kids, that they have to have access to good income, that all these social systems really do impact health equity at the end of the day, that we have to work with across sectors, with government and the public sector and the private sector to really improve these outcomes. At that point is when we'll be able to address these issues. And I think part of what the March Times is trying to do is to say, how can we work across sectors with others to really improve health outcomes for all, especially for moms and babies. But it's going to be a matter of public will in this country if we're going to get to some real results.
Yeah, and I think you're so right. I think we really have to move into the home, into the community, to be able to get at this issue. And it's being in touch with people where they are where and how they are, instead of saying, okay, you can come to my office somewhere across town. That's never going to get it. And I think one of the good things coming out of the pandemic is that we've learned to be in the community more. I mean, we're starting to see those efforts of, devices and technology that enable us to really kind of get to where our people are. And I think that that is making a big difference. The issue of, and I think you're so right. I think it's a national embarrassment. It's a shame in terms of our outcomes, in terms of where they are. Anything specifically that on the maternal, morbidity side that you think we should, if we're talking to all of our 5,000 folks in health, in hospitals and healthcare that are out there, what message would you give them if you were going to start somewhere?
Absolutely. Well, I think a lot of folks may know that we just recently entered into a partnership with HHS and received funding from United Healthcare to really look at a whole maternal health quality improvement effort in hospitals around the country, and starting with a few hospitals and then moving to other hospitals, especially hospitals that really do see a large percentage of Black and brown women delivering at those hospitals. And how can we really, really move to a higher level of quality improvement in terms of the way that those women receive care, especially during their pregnancy, but while they're in the hospital, and then even after they leave, so that we really can make a big difference. I think we'll learn a lot from that. And I think some of the other efforts around data improvement, data gathering, data analysis, some of that got started with our Preventing Maternal Deaths Act that got passed in 2018. We were so pleased to be a part of helping to pass that, allowing there to be maternal mortality review committees in every state, funding for that so that we could collect better data and assess that data to know what are the best interventions for women so that we can actually improve care. I go back to what the CDC has said about maternal mortality, that 2/3 of all the deaths that have occurred are actually preventable.
Yeah.
If we actually provide the right quality care to women when they need it, if we don't delay diagnoses for women when they are exhibiting certain kinds of symptoms, if we listen to women when they complain of issues and problems and respond to that, as opposed to potentially letting our implicit bias enter into the picture. And if a woman complains of pain or shows certain symptoms, maybe it's because these are real things for her, not that she's imagining them, right? Which unfortunately we've heard too many cases of. It's not to lay blame again on any one person. I think there's a lot of issues that have to go on, but when we look at the fact that with some improved and different models of care, if we look at even how do we employ other kinds of models of care in the hospital setting and into the healthcare setting in general, how we can look at doulas and midwives differently, how we learn from what other industrialized countries do in terms of inviting midwives and others into the system of care. We don't do some of those things in the US, and we have to be willing to do things differently if we want to see different outcomes. So it's those kinds of things that we're working on at the margin on. So we're really sort of saying, we need to be entering into a new phase, a new generation of maternal and infant care, learning from what others are doing and deciding that it's important for us to employ those evidence-based models of care. If we can see that there's a potential for them to improve outcomes, we ought to be willing to put those things into place and into practice so that we don't lose yet another life, another woman, another baby, because we just didn't do the things that we know could actually work better for them.
Well, I think that's just a perfect ask, and I'd underline that. And I can commit to you, on behalf of the AHA, our full support on this issue, because there's nothing more important than, how do we care for people at the beginning of their lives and for their moms? And if we want to really make a lasting impact on health in the United States, this is a great place to start. So I can tell you that I know the board at AHA, and I know our staff is, really wants to drive in behind this. And we just want to congratulate the March of Dimes again for this award. But more importantly, what a great taking off point for us to be more together as.
Absolutely.
So thank you so much. And I think we could go on for an hour, but think we hit the major points, and it's great to have you in these leadership rounds. We're looking for people that make a difference, and you're one of those people, and we're so proud that you could be part of our program. So thank you again, Stacey.
Thank you so much, and thank you for the honor. And it's a great honor for me to lead this organization and to work with AHA. And I really appreciate it. I hope we all have more and more times and opportunities to partner with each other. So thank you so much.
Thank you.